Hello, it's Diagnosis Bona Kuratze Bona, and today we will talk about scrotal swelling. What's the cause of this sign, and also we will talk about undescended testes, testicles, and because it's also a very important condition, and this condition is increases a risk of a tumor, and also there is a connection, or how to say, if you see undescended testes or testicles, also you can see inguinal hernia too. And okay, so let's get started. Let's talk about it in details. Testicular tumors. It's when malignant cells develop in the tissue of one or less commonly both testicles. And these malignant cells arise from the germ cells, and all these testicular tumors divided into two groups: seminomas and non-seminoma germ cell tumors. So it's what clinical features? It's usually young men, ages 15 to 40 years. It's often painless, unilateral testicle scrotal mass, and also can be loss of testicular sensation, may have associated with hydrocele and gynecomastia, and also could be symptoms of metastatic disease. Okay, investigation. So ultrasound of the testes should always be done, and also there are some tumor markers: alpha photoprotein and beta HCG, or human chorionic gonadotropin. Also there is lactate dehydrogenase. It's an enzyme which helps to monitor secondary spread of testicular cancer, and also for staging use CT scan of abdomen, pelvis and chest. Okay, so for non-seminoma germ cell tumors, serum level of alpha fetoprotein and beta HCG is elevated in 85%. For seminomas, it will be for beta HCG just 25%, and alpha fetoprotein is not elevated at all. Okay, treatment. So seminoma of the testis is associated with a very good prognosis. And what's the treatment? It's orchidectomy through inguinal approach. It's the best initial treatment. And also it's interesting that non-seminoma germ cell tumors they are don't respond on radiotherapy, so it's just orchidectomy, and if relapse it will be chemo. Undescended testicles or testis. Of course it's not an example or condition for scrotal swelling, and I would say it's opposite of this condition, of this swelling, because it will be absent testicles in scrotum. And but it's very important to know, because people who have undescended testicle have risk of testicular cancer. So at normal testis can still distend up to 3 months, and the treatment have to be between 6 to 18 months. If this child will be older than 2 years, so this treatment will be useless. Also, undescended testicles associated with testicular neoplasm, subfibrility, testicular torsion, and inguinal hernia. So if you see a child have undescended testicles, it's more likely that this child also have inguinal hernia. Investigation, it's physical examination and ultrasound. Management, it's just orchidopexy. And also, what about complications? So what the problem of non-distended testicles? It's testicular dysgenesis and dysplasia that lead to infertility. Torsion, also testicular cancer, as I said, it's from 5 to 10 times greater. And also it could be susceptible to direct trauma if in inguinal region, and also psychological. Acute Epididymo-orchitis. It's an acute inflammation of the epididymis, often involving the testes and usually caused by bacterial infection. Most cases due to chlamydia trachomatis, and also it can be Mycoplasma genitalium, gonococcus, and for old people, usually urinary tract pathogens. So clinical features will be, it's often history of dysuria and urethral discharge. Also swelling may be tender and eased by elevating testes. So it will be positive Pran sign. It's important to know because for testicular torsion, this sign will be negative. And also how we can differentiate with testicular torsion. So for acute epididymo-orchitis, it's usually attack usually begins with malaise and fever, and for testicular torsion it will be very sudden, severe pain. And investigation. So it will be leukocytosis. So urine microscopy and culture will show pyuria, bacteria, and possibility E. coli. If it's a culture sterile, suggests the possibility of chlamydial or gonorrheal infection. Also, nucleic acid amplification test and polymerase chain reaction will show you that there is chlamydia, gonococcus, or Mycoplasma genitalium. Also you can do this swabs of discharge to find gonococcus. And also ultrasound is important because it can differentiate a swollow epididymis from a testicular tumor. So treatment, it's bed rest, elevation and support of the scrotum, analgesics and antibiotics for sexually active men. So they should be treated for chlamydia or gonorrhea infection. It's ceftriaxone, just single dose ceftriaxone with single dose of azithromycin, and then doxycycline for 14 days. If it's associated with urinary infection, it will be trimethoprim for 14 days, or it could be also cefalexin, amoxicillin, or norfloxacin. So so you have to choose just one of them. And if severe infection, it will be administered parenteral gentamicin with ampicillin and norfloxacin. Testicular torsion. It's a twist of the spermatic cord resulting in testicular ischemia and necrosis. And so it's usually typically affects adolescents and young males. So it will be rare, severe, sudden onset testicular pain, and on examination, testis is tender and pain not eased by elevation. So it's a negative Pren sign. And investigation, it's ultrasound, also very helpful, color Doppler and technetium 99 scan. It will show you this area. So for example, for acute Epididymo-orchitis, it will be, you will see this this blood supply will be normal, and for testicular torsion, this area will be ischemic. And so the treatment is prompt surgical exploration and testicular fixation. So if it's viable, it will be orchidopexy, and if it's of course if it's a gangrenous testicle, it's just remove. And also urgent surgery is indicated. The contralateral testis is also should be fixed, because there is this condition, it's called bell clapper testis, when testes are hanging in the scrotum and can swing freely like a clapper in a bell, and it's so it's usually bilateral. Hydrocele, it's it presents as a mass that trans-illuminates, and it's not painful. Soft fluctuant swelling usually contain clear fluid, and usually transillumination will prove that it is cystic, but if the diagnosis is in doubt, perform an ultrasound. And it's also have to remember that it may be presenting feature of testicular cancer in young men, as I said. So testicular tumor can mask this like a hydrocele, as a hydrocele, and in children it may occur as a result of a patent processus vaginalis. So treatment is just reassurance and scrotal support usually, but also it can be simple aspiration with or without the injection of sclerosing agents, but there is many side effects of sclerosing agents, because this tissue can be inflamed due to these sclerosing agents, and in some cases could be surgery. Hematocele, it's blood in scrotum but outside of the testes, and It's often following acute trauma or surgery. So clinical features, it's usually soft, non-tender, fluctuant mass. It could be sudden pain, especially if it's acute hematocele, and also it could be dual etching pain or feeling heavy in the scrotum. So for acute hematocele, it will be tense, tender, and non-transilluminating mass post-trauma. And for chronic hematoma, cause, so it will be a blood clot to surrounding the testis, and it can be shown in ultrasound. Management, if it's less than 3 times of contralateral testis, it's just conservative therapy. If it's larger, it will be surgery. Varicocele, it's a varicosity of the veins of the pampiniform plexus due to mechanical problem in drainage of the left kidney vein. It's because testicular vein drains into renal vein, and so it's affect testis and maybe smaller, and bilateral varicocele may affect fertility. And the clinical features, it's enlarged veins in the scrotum, often left testis, and it's like a bags of worms. So it's investigation ultrasound, the best method, and the management, it can be so treatment usually conservative, but if there is infertility due to varicocele, it can be venous ligation above the deep inguinal ring. Inguinal hernia. In the abdominal wall there is some weak points, and through this weak point or place can go through some fat or a loop of small intestine, and one of this point is a inguinal canal. And so clinical features, it also can be like a swollen scrotum too, and also it could be pain or discomfort. Sometimes it can be painless. So, but the most important thing that we have to treat it. The general rule is we have to treat it as soon as possible, because there is a risk of strangulation with painful, firm, tender, and irreducible mass, or bowel obstruction. So there is a clinical threat. It's vomiting, absolute constipation, and distension. So ultrasound can show you this, and management, as I said, as soon as possible, or there is if it's a reducible hernia, this rule 6 2, it is between 6 week surgery with 2 days, 6 weeks to 6 months surgery with 2 weeks, and over 6 months surgery with 2 months. Okay, so now let's repeat all this information. So what's the cause of scrotal swelling? It can be testicular tumor, it can be seminomas or non-seminoma germ cell tumors, and seminoma have a good prognosis and can be treated with orchiectomy, with radiotherapy, and non-Simeona germ cell tumors can be treated with orchiectomy with chemo. And it's very important that we can diagnose tumor using ultrasound or markers, alpha fetoprotein or beta ECG. Next is testicular torsion. It's a very urgent situation and it has to be treated within 4 to 6 hours. Next is acute Epididymo-orchitis, and this condition usually caused by bacteria, and of course will be treated by antibiotics, and it's usually due to chlamydia. Next is epididymo cyst. So this treatment can be just reassurance or aspiration of this cyst. Next is Hydrocele here. So this best diagnostic method will be transillumination, and it can be treated just reassurance or aspiration. And for Hematocele here, when there is a blood in the scrotum, it's usually after trauma, and it's usually painful. So it's very important actually to know which condition is painful and which is not, because what these two conditions, testicular torsion and Epididymo-orchitis, they are painful, but this pain will be different. For torsion, it's a very severe, very onset, very sudden, so it's a very pain, so it will be severe pain. And for Epididymo-orchitis, it's usually this also will be pain, but not so severe, and also it can be fever and malaise. Okay, so I stopped here. So it's Hematocele, and it can be treated with aspiration or conservative. So next is, and the last one is Varicocele. It's a varicosity of the penfiniform plexus, and so this condition you have to treat conservative or with ligation. So it's the end of this video, and thank you very much for watching this video. See you next time. Bye bye.